Hello. In this video, we will review tracheostomy stoma care. Tracheostomy care is generally done twice daily to keep the stoma clear of crusting and secretions in an effort to keep your child's skin healthy. Let's review the equipment that you will need to have with you. You will need 8 cotton tip swabs, 4 gauze pads, a Velcro trach tie, dressing, a shoulder roll, and sterile water. You will also need your trach emergency equipment, such as suction setup, your backup tracheostomy tube, a downsized tracheostomy tube, water-based lubrication, syringes in case your child has a cuff tube, and a resuscitation bag. At Texas Children's Hospital, this is always a 2-person procedure, but we understand that in the home care setting, you may be alone. Begin by washing your hands. Set up the supplies. Go ahead and wet 4 cotton tip swabs and 2 gauze pads with sterile water, and leave the remainder dry ones to the side. Cut a new Velcro trach tie to the appropriate size. Put on gloves if needed. Place a shoulder roll under your child or have them tilt their head back to expose their neck if possible. Remove the soiled dressing and look at the neck, noting any areas of skin redness, irritation, breakdown, or extra skin tissue. While the Velcro collar is in place, clean the stoma by separating it into 4 sections using the 4 wet cotton swabs. Roll the wet cotton tip applicator starting from the closest to the stoma, going outward 1 area at a time, like so, to prevent any germs from the surrounding area entering the stoma. Use 4 dry swabs to dry the trach site, moving from the stoma outward 1 area at a time in the same manner. If you are doing this alone, hold the trach in place with 1 hand and remove 1 Velcro strap at a time. Cleanse each side of the neck with a wet gauze pad from stoma outward, then dry the neck with dry gauze pad from stoma outward. Attach a new trach tie by looping in the Velcro tie into the flange of the trach and securing it into place. Go ahead and gently apply the dressing your child uses, and making sure there is only 1 finger width between your child's neck and their Velcro trach collar. Call your provider if there is any sign of skin infection or irritation of the skin surrounding the trach tube. Signs of infection include redness, swelling, drainage, cuts, foul odor, yellow or green secretions. Remember, if you apply nystatin powder, then apply it to the Velcro tie instead of applying it directly to your child's neck to prevent irritation to their airway.